Extract 1. Questions 1 to 12. You hear an endocrinologist talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Good morning, Mihiraa. Please, come in and have a seat. What brings you to my clinic today?
Hi, Dr. Marigold. Thank you for seeing me. It's been a while. I've been experiencing this persistent pain in my lower back curve and legs, along with a feeling of weakness in my muscles, especially when I try to stand up or climb stairs.
I see. How long have you been experiencing these symptoms?
It started gradually about 6 months ago. It's become cumulatively worse in the last few weeks, interfering with my daily activities.
Can you describe the pain in more detail, Mihiraa?
It's more of a cramping that radiates down my legs and sometimes into my hips. It worsens when I'm on my feet for too long or when I try to lift anything heavy.
Have you noticed any other symptoms, like fatigue, weight changes, or changes in your menstrual cycle?
I do feel more weary than usual, but I haven't noticed any significant weight changes or changes in my cycle.
Okay, Mihiraa. Have you tried any medications or other remedies for the pain?
Yes, I've been taking Celebrex for the pain, but it doesn't seem to help much. I also tried some over-the-counter muscle relaxants, but they didn't make a difference either.
I understand. Have you had any previous medical conditions or surgeries?
Not really, except for a subtle thyroid problem that was diagnosed a few years ago. I'm currently on medication for it.
Do you have any family history of bone or muscle disorders?
My mother has osteoporosis, and my grandmother has a history of pathological fracture.
Interesting. Mihiraa, based on your symptoms and family history, I suspect there could be several possible explanations for your pain and weakness. To further investigate, I might recommend some additional tests like blood work, X-rays, and possibly a bone densitometry test.
Okay, I understand. What about the pain? Is there anything I can do to manage it in the meantime?
Certainly. I can prescribe stronger pain medication, Dilaudid, to help manage the discomfort. It's important to remember that medication alone might not address the underlying cause. Mihiraa, I also recommend incorporating some gentle physical activity like walking or swimming to maintain muscular stamina and stretchiness.
Thank you, Dr. Marigold. I appreciate your explanation and recommendations.
You are welcome, Mihiraa. Please schedule an appointment with my clinic coordinator to discuss the next steps and test results. Don't hesitate to ask if you have any further questions.
Extract 2. Questions 13 to 24. You hear a general practitioner talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Good morning, Mihiraa. Please, come in and have a seat. What brings you here today?
Thank you, doctor. I've been having trouble with this wound on my leg for about 2 weeks now. It just won't seem to heal properly.
I see. Where is it located?
It's on my right shin, just below my knee.
Can you tell me more about the wound, Mihiraa?
It started as a small scratch, but it's gotten bigger and redder. It's also quite painful, especially when I walk.
Have you tried anything to treat the wound at home?
Yes, I've been cleaning it with tea tree oil solution and keeping it covered with a bandage. I even tried some over-the-counter ointment, but nothing seemed to work.
Okay. Now, to understand this better, could you tell me a little about your medical history? Have you ever had any problems with wound healing before?
Not really. I do have asthma, though, and I'm allergic to sulfonamides.
Thank you, Mihiraa. Are there any other medical conditions you'd like to mention?
Well, I do have high blood pressure, and I'm currently taking medication for it.
Right, and what medications are you currently taking?
I take olmesartan for my blood pressure, salbutamol for my asthma, and I use anticholinergics occasionally.
Okay, Mihiraa. Now, tell me about your lifestyle. Do you have a physically demanding job?
I work as a teacher, so it's not too strenuous. I do try to go for walks and do some yoga most days though.
Excellent. Based on what you've described, there are a few possibilities for why your wound might not be healing well. It could be a simple infection, but Mihiraa, it's also important to rule out any underlying conditions like diabetes or vascular issues.
Okay, that makes sense. What tests would you recommend?
Well, let's start with a basic wound microbial sampling to check for any infection. We might also need to do a blood test to check your sugar levels and blood flow.
I understand, doctor.
In the meantime, I'll prescribe you a new antibiotic ointment, bacitracin, suitable for you to apply to the wound. It's important to keep the wound clean and covered and to elevate your leg as much as possible to reduce puffiness.
Thank you, doctor. I appreciate it.
You're welcome, Mihiraa. Please come back and see me in a week to discuss the test results and any further treatment options. If required, I'll also give you a referral to a wound care specialist for further assessment and treatment.
I will, doctor. Thank you again.
That is the end of Part A. Now check your answers.